Hi, and welcome to the VieSID Press-release. In this video, we report on articles selected from the dental literature published in May 2023 that we hope might be of interest to the VieSID community. So let's begin. In Acta Odontologica Scandinavica, we found an article by Tornavitis et al. Evaluating the effectiveness of different conservative therapeutic modalities for TMD pain. They selected randomized clinical trials published between 2001 and 2021, including patients older than 18 years and with TMD diagnosed using either the DC-TMD criteria or the RDC-TMD. Eventually, they included 28 articles that considered occlusal splints alone or in combination with other therapies, relaxation, biofeedback and manual therapies, laser therapy, botulinum toxin A treatment, cognitive behavioral training, and hypnosis. Based on these articles, they concluded that occlusal splint and occlusal splint combined with other therapeutic interventions have a superior short-term efficacy in pain reduction, followed by photobiomodulation and low-level laser therapy. Ekman et al. Investigated the association between self-reported sleep and awake bruxism and TMD. Data were gathered from subjects born in Finland 1962 who participated in a study between 2012 and 2013 at the age of 46. Over 12,000 people were involved in the study. Bruxism and TMD were assessed via a questionnaire. 6,868 people replied. Of these, 1,962 were clinically examined using the DC-TMD. The authors found that the prevalence of self-reported bruxism was around 40%, and this was about 38% in sleep bruxism and 10% for awake bruxism, 34% in men, and 44% in women. Myalgia and arthralgia were significantly associated with sleep bruxism and awake bruxism in women. This displacement with reduction was also associated with sleep bruxism and awake bruxism in women and with sleep bruxism only in men. Degenerative joint diseases were associated with sleep bruxism in women. Head and Face Medicine published a work by M. Schoff et al. And in this paper, they evaluated the association between condylar erosion and this displacement without reduction combined with arthralgia. They considered 62 consecutive patients between the age of 18 and 67 years. The TMJs were clinically assessed via RTC-TMD. Both this displacement and TMJ degeneration were assessed by means of MRI. The authors found that condylar erosion was 3 times more prevalent in TMJs affected by this displacement without reduction than on painful non-dysfunctional joints. Frequencies of osteophytes and subchondral sclerosis were not statistically significant. This study partially concords with the findings of previous works, including that of Fan et al. 2023 that we reviewed last March. These authors in Fan et al. 2023 found that anterior disc derangement and anterior and side disc derangement were associated with all types of degenerative conditions of the joints. In the current paper, we found, however, some limitations. First of all, the authors used MRI to assess TMJ bone degeneration. They observed that MRI was suitable, but I have some doubts about it. Also, the results that were reported in somewhat confusing way, as they considered this displacement both as determinant and as an outcome. In an editorial by Allers, the Journal of Craniomandibular Function announces the development of a new diagnostic scheme of the DGFDT, which is the German Society for Functional Diagnostic and Therapy. Although the new guidelines are not yet published, Allers informed that they build upon the DCTMD and implement findings regarding occlusion and jaw relation, and include also, and especially, functional diagnostic and therapy. In the Journal of Evidence-Based Dental Practice, Liu et al. Published a study assessing the bidirectional association between temporomandibular joint disorders, that the authors abbreviate as TMJD, major depressive disorders, abbreviated as MDD, and anxiety disorder, ANXD. This was a retrospective cohort study considering records from the Taiwan National Health Insurance Database. The authors analyzed the TMD as the cause of subsequent major depressive disorder or anxiety disorder, and temporomandibular joint disorder as the consequence of major depressive disorder or anxiety disorders. Patients with antecedent TMJD were over 12,000 for the assessment of possible subsequent depressive disorder, and over 11,000 in the analysis in association with anxiety disorder. For major disorders at baseline, they analyzed over 28,000 individuals, and for anxiety disorder at baseline, they had over 21,000. They also consider a cohort control, all selected from the records between of the years 1998 to 2011. The control cohorts were selected in a ratio 1 to 10 and were matched by age, sex, income, residential location, and comorbidities. Individuals with subsequent new onset of temporomandibular joint disorder, major depressive disorder, or anxiety disorders were identified from 1998 to 2013. The risk of the outcome disorders of the individuals with antecedent temporomandibular joint disorder, major depressive disorder, and anxiety disorders were estimated using the Cox regression models. Patients with temporomandibular joint disorders and an approximately threefold higher risk of subsequent major depressive disorders and a sevenfold higher risk of anxiety disorders than those without temporomandibular joint disorders. Antecedent major depressive disorder and anxiety disorders were predictive of a approximately six-fold and eightfold respectively increases in the risk of subsequent temporomandibular joint development. In this paper, a bidirectional association between temporomandibular joint disorders and major depressive and anxiety disorders was shown. I remain curious about the possible shared etiological factors. Antecedent major depressive disorder and anxiety disorder were predictive of approximately six-fold increases in the risk of subsequent temporomandibular joint disorder, while anxiety was predictive Antecedent major depressive disorder and anxiety disorder were predictive of increased risk of subsequent temporomandibular joint disorder in a six-fold and eightfold way, respectively. In this paper, a bidirectional association between temporomandibular joint disorders and major depressive and anxiety disorders was shown. I remain curious about the possible shared etiological factors. In the Journal of Oral Rehabilitation, we found a paper by Agren et al. On the effect of masseter single botulin injection on bite forces. 20 individuals seeking aesthetic treatment for masseter reduction were considered. These received 25 units of xeomin, botulin neurotoxin type A, injected into the masseter muscles on both sides. They were compared to a reference group of 12 individuals that did not receive any intervention. The study and control groups were comparable in terms of bite forces, sex, and age at baseline. Maximal voluntary bite force was measured at baseline, at 4 weeks, 3 months, 6 months, and after 1 year. While the study and control groups didn't differ significantly at baseline, the authors found a reduction in terms of bite forces after treatment that became statistically significant after 3 months and normalized at 6 months. This reduction was detected at the midline and also at the level of the first molars. I remind you the outcomes of the animal experimental model by Ehring et al. That we discussed last November, in which the authors showed that repeated botulinum treatment of rabbit masseter causes cumulative tissue damage. We come to the end of this presentation. I invite you to contact us in case you want to know more about our activities. Otherwise, be ready for next press release. Best wishes to all.